The trachea divides at the level of the lower border of the fourth thoracic vertebra into two primary principal bronchi, one for each lung. The right principal bronchus is 2.5 centimeter long, shorter, wider, and more in line with the trachea than the left principal bronchus. The inhaled particles or foreign bodies therefore tend to pass more frequently to the right lung, with the result that the infections are more common on the right side than the left side. The left principal bronchus is 5 centimeter. It is longer, narrower, and more oblique than the right bronchus. The right bronchus makes an angle of about 25 degrees from the tracheal bifurcation, while the left bronchus makes an angle of 45 degrees with the trachea. Each principal bronchus enters the lung, right? It's entering the lung through the hilum and then divides into secondary lobar bronchi, one for each lobe of the lung. There are three lobes on the right side and two lobes on the left side. Each lobar bronchus, you can see the secondary or the lobar bronchus, divides into a tertiary or segmental bronchi here. Tertiary or the segmental bronchi. Each one for each bronchopulmonary segments, there are 10 on the right side and there are 10 on the left side. The segmental bronchi divide repeatedly to form very small branches called the terminal bronchiole. Still smaller branches are called the respiratory bronchiole. Each respiratory bronchiole aerates a small part of the lung known as a pulmonary unit. The respiratory bronchiole ends in microscopic passages which are termed the alveolar ducts, the atria, air sacules, and finally the pulmonary alveoli. Gaseous exchange takes place in the alveoli. Now, what are these bronchopulmonary segments? Bronchopulmonary segments are well-defined anatomical segments aerated by a tertiary or a segmental bronchus. They are pyramidal in shape with the apex directed towards the hilum and the base directed towards the periphery, having their own arterial supply. With the venous drainage, you can see this is one bronchopulmonary segment having its own arterial supply, but the venous drainage is shared by the adjacent bronchopulmonary segment. Here you can see this is the right lung, this is the first lobe, superior lobe, middle lobe, and the inferior lobe. The superior lobe has three bronchopulmonary segments, the first one being the apical segment over here, the posterior segment, and the interior segment. Coming to the middle lobe, we have a lateral segment and a medial segment. If we see the inferior lobe, there is a superior segment of it and then the basal segment of it. There is the medial basal, which is not seen in the costal surface, it is seen in the mediastinal or the medial surface. Anterior basal segment, the lateral basal segment, and the posterior basal segment. Mind you, the medial is only seen in the medial surface. Similarly, on the left side, we had two lobes demarcated by the oblique fissure, the superior and the inferior lobe. The superior lobe has an apico-posterior segment 1 and 2, anterior segment, superior lingular and the inferior lingular segments. Again, we have the inferior lobe, the superior segment. Then we have the basal segment. We have the medial basal on the medial side only, anterior basal, lateral basal, and the posterior basal. Now, they are well defined surgical, anatomical and functional sectors of the lung, each one aerated by a tertiary or segmental bronchus. Each segment is pyramidal in shape with its apex directed towards the root of the lung. Each segment has a segmental bronchus, a segmental artery, autonomic nerves, and lymph vessels. These segmental venules lie in the connective tissue between adjacent pulmonary units of the bronchopulmonary segments. During segmental resection, the surgeon works along the segmental veins to isolate a particular segment. Relation with the pulmonary artery. The branches of the pulmonary artery accompany the bronchi. The artery lies dorsolateral to the bronchus, mind you, dorsolateral to the bronchus. Each segment has its own separate artery. Relation with the pulmonary vein. The pulmonary veins do not accompany the bronchi or the pulmonary arteries. They are running in the intersegmental planes. Each segment has more than one vein, and each vein drains more than one segment. Near the hilum, the veins are ventromedial to the bronchus. It should be noted that the bronchopulmonary segment is not a bronchovascular segment because it does not have its own vein. Now, coming to the clinical aspect, the infection of the bronchopulmonary segment generally remains restricted to one particular segment, but tuberculosis and bronchogenic carcinoma may spread from one to another bronchopulmonary segment. Tuberculosis of the lung is the commonest disease. Now, knowledge of the anatomy of the bronchial tree helps in the segmental resection, visualizing the interior of the bronchi through a bronchoscope passed through the mouth, you can see over here, and the trachea. This procedure is called bronchoscopy. Now, carina, it is a hook-shaped process projecting backwards from the lower margin of the lowest tracheal ring. It helps to divide trachea into two primary bronchi. The right bronchus is making an angle of 25 degrees, whereas the left one is making an angle of 45 degrees. Foreign bodies mostly descend into the right bronchus as it is wider and more vertical than the left bronchus. The carina of the trachea is the sensitive area. When the patient is made to lie on her left side, secretions from the right bronchial tree flow towards the carina due to gravity. This stimulates the cough reflex and the sputum is brought out. This is called the postural drainage. The enlarged lymph nodes present in this area may distort the carina. Paradoxical respiration, what is this? During inspiration, the flail or abnormally mobile segment of the ribs are pulled inside the chest wall, while during expiration, the ribs are pushed out. Right. So, auscultation of the lung, upper lobe is auscultated above the fourth rib on both sides. Lower lobes are best heard on the back. Middle lobe auscultated between fourth to fifth on the right side. The superior segment of the lower lobe is most dependent part of the bronchopulmonary segment in supine position. Foreign bodies are likely to be distinguished here. What is bronchial asthma? Common disease of the respiratory system occurring due to bronchospasm of smooth muscle in the bronchioles. Patient has difficulty during expiration, can also be accompanied by by wheezing. Epinephrine, which is a sympathetomimetic drug, relieves these symptoms. Now, briefly about the embryology. In the proximal part of the floor of the primitive pharynx, appearance of the laryngotracheal diverticulum about 4 to 6 weeks. It separates the esophagus and then it elongates, forming the laryngotracheal tube. The proximal part will form larynx in 10 weeks. At 10 weeks, distal part forms trachea. This trachea bifurcates into the right and the left lung bud. Then the it ramifies to right principal bronchus and three secondary bronchus in the right and two in the left part. It has dichotomous divisions forming tertiary bronchus, then the lung alveoli. The lung alveoli has four stages, that is the pseudoglandular stage, 5 to 17 weeks, the canalicular stage, 16 to 25 weeks, terminal sac stage, 24 weeks, and the alveolar stage, that is the late fetal period to 8 years after birth.